to the Upper Iowa University Great Debate. My first question is, how does mandatory overtime affect staffing? Please start with your name and your point.
Hi, my name is Caitlyn Lancaster, and I'm here today to share with you some of the benefits of mandatory overtime in nursing. There are many advantages to mandatory overtime in nursing that many people aren't aware of. And the first one I'm going to go over is sufficient staffing. So according to the Department of Professional Employees fact sheet from 2016, adequate staffing is key to patient care and nurse retention, while inadequate staffing endangers patients and drives nurses from the profession. According to this fact sheet from 2016, it also states that safe staffing improves nurse performance and patient mortality rates, reduces turnover rates, staffing costs, and liability. So these are a few points as to why sufficient staffing is a benefit to mandatory overtime in nursing.
Well, thank you, Caitlyn. What's your stand on decreased cost?
The next point I'm going to go over is decreased cost to the company. This is another great benefit to mandatory overtime in nursing. According to an article written in 2017 in Nursing Economics Journal, healthcare facilities can manage nurse shortages and high census peaks without hiring additional permanent personnel with the associated costs for benefits. This means that using their own employees instead of hiring agencies outside of the facility will lessen their costs. Another point that they made in the Department of Professional Employees fact sheet was that supplemental nursing staff are expensive, especially when they're brought in from outside agencies. Temporary nurses are often compensated rates 25% to 40% above the average RN's wages. This would cost the company a lot of extra money that could be saved by using mandatory overtime in nursing. So these are just a few points as to why mandatory overtime can be beneficial to both patients and the employer. Thank you.
Thank you, Caitlyn. My next topic is going to be in regards to continuity of care and how mandatory overtime affects that. Please start with your name and your point.
Thank you, and good afternoon. I'm Judith Anderson. I'd like to speak on the point of continuity of care in regard to mandatory overtime. Mandatory overtime creates and improves continuity of care. Continuity is defined by Tabor's Medical Dictionary as, and I quote, "the condition of being unbroken, uninterrupted, or intimately united." Continuity of care has an impact on quality care results that positively benefit patient outcomes. These benefits include better experience, increased nursing job satisfaction, creating a relationship of cooperation between the nurse and the patient, information accuracy can be maintained, goal setting and monitoring can be improved. The patient's trust for the nurse increases, which increases advice to be accepted. Easier to see changes in patient condition. Familiarity of medication means less error opportunities. Lower length of patient stay and lower costs. Increased in the patient's feeling of being valued and a decrease in admissions into the hospital. All of this information was found in an article by William J. in 2014 called Potential Benefits of Relationship Continuity in Patient Care. Patient care is affected and improved with mandatory overtime, and that is my point to support it. Thank you.
Thank you, Judith. Next, I would like to know the stand on employee income affected by mandatory overtime. Please start with your name.
Good evening, everyone. My name is Brenda Burrows, and I will be talking to you about the benefits of an increased income with mandatory overtime. A study done by the Urban Institute and Center of Society and Health 2015 states the following facts. An increased income creates better access to healthy food. Low-income communities tend to have limited access to green space, recreational programs, and facilities for regular exercise and active living. Low-income communities are more frequently targeted for tobacco, alcohol, and high-calorie foods. People with limited resources experience higher rates of inadequate and unstable housing and exposure to indoor pollutants. Public transportation is often inadequate to enable residents to commute to employment, to find a better job, to a reliable daycare service, to reach the supermarket or health care services. People with low incomes are more likely to live in poor neighborhoods with a weaker tax base, thus reducing local resources that support public schools and social services. Low-income neighborhoods often face a shortage of employment opportunities, as well as primary care providers and high-quality clinical facilities. Low-income residents are less likely to be able to afford living in neighborhoods that are free of pollutants. For these reasons, an increased income is of very many benefits to a nurse. A study done by Bay 2012 found that 64% of nurses who worked overtime reported that they worked overtime because they needed the money and that they enjoyed that increase in income. An overview of all types of overtime, over 50% responding nurses said they worked overtime in order to make more money, and an average of 38% of nurses working overtime reported that they liked to work overtime whenever overtime was needed, therefore creating a better life and a better community. Thank you.
Thank you very much, ladies, for bringing up positive points to support mandatory overtime. This concludes the Upper Iowa University Great Debate. Thank you for your time.